Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center in Fort Myers, Florida. Today we're going to talk about Hauser's laws, and I'm going to give some of the background of how over the course of 30 years I came up with these structural laws of the cause of human disease as it relates to structure. For those who want to delve deep into this topic, I'd recommend that you see this article that was published, Hauser's Laws on the Ligamentous Structural Causes of Chronic Disabling Symptoms of Human Diseases. And there's the link. So I would really encourage you to read that if you really want to delve deep into the topic of ligamentous joint instability. I wrote this to show the extensiveness of all the different things that ligamentous joint instability causes, and I came up with 4 different laws. But in a nutshell, when you have ligament damage in a joint, it's like a screw on a hinge. Once that joint starts having excessive motion, the excessive motion leads to excessive pressure, and excessive pressure is what causes cells to die, and that's where you get ligaments or weakened ligaments, tendinosis, weakened tendon, articular cartilage degeneration, joint swelling, and basically any nerves that are near the joint, the function of those nerves could be compromised because of the pressure from the bones moving too extensively because of the ligament damage. Before we start, I just want to say that I'm really happy about all the people that are posting different things on ligamentous joint instability, especially ligamentous cervical instability. Like last night, I got a feed of a patient named Rachel, never met this Rachel, and she was just explaining how she'd went to a whole bunch of doctors, and then it took many years to get the diagnosis of upper cervical instability. And people with upper cervical instability, they're everywhere. Like right before this video, I was at Chocolat, which is a coffee house in Fort Myers, very good. And while I was waiting, there's a young gal, probably in her mid to early 20s. She had 2 children, and she had just finished her meal. Well, we got into a conversation, and I was saying to her, the more hard job is her being a mother and trying to raise 2 wonderful children. Like, she has the harder job than me being a physician. Like, that is the hardest job, is to raise nice human beings. Well, she went on to tell me that a doctor wanted to give her anti-anxiety medicine, and she's like, I like to get at the root cause. Well, I said, well, what's the symptom? And then she said internal tremors. So I said to her, I think I made a video on that, and sure enough, I had made a video, so we kind of exchanged information. But that's just one little story of all of us trying to get the word out that ligamentous joint instability is a real serious problem, and we need to try to help as many people as we can. One of the people that I helped is Lisa, who comes in every so often with her amazing daughter Gwen, who I think in the future Gwen's going to be a physician. It says, and they made this for me, what makes you different is what makes you special. Nobody can do what you do exactly the way you can do it. What makes you different is what the world needs, the original way you see things, your exciting story, your unique strength. What makes you different is what's worth celebrating today, your big heart, your brave life, your one-of-a-kind spirit. And then both Gwen, the daughter, who's probably 11 maybe, she's just thankful that her mother's feeling better. And the mother just said, thank you so much for everything. I don't know where I would be in my recovery without you. So I just wanted to read that because all of us who are trying to get the word out on ligamentous joint instability, that could be said of all you guys too, man. Just keep letting people know all the different things that ligamentous joint instability can cause. So I want to go back to a little bit of the history of how I came up with Hauser's laws. Anyone who knows me, in the 1990s, I wrote a bunch of books: Prolo your arthritis pain away, Prolo your pain away, Prolo your fibromyalgia pain away, Prolo your knee pain away, and Prolo your lower back pain away. So the main emphasis of my writing, and this was before the internet era, it was to educate people on the benefits of prolotherapy, that prolotherapy is a good treatment to tighten ligaments and resolve chronic pain. So the number one thing that we would see is chronic pain, chronic headaches, chronic neck pain, chronic shoulder pain, chronic knee pain. So that relates to Hauser's law number 1. These are Hauser's law. Hauser's law number 1 relates to ligamentous joint instability causing joint degeneration. Hauser's law number 2 has to do with ligamentous joint instability or cervical instability related to affecting nerve function. Hauser's law number 3 relates to ligamentous cervical instability causing a lot of symptoms because of dynamic carotid sheath compression, especially compression of the jugular vein. And then when these 3 laws don't explain a person's symptoms, then you go to Hauser's law number 4, which relates to a ligamentous joint instability or cervical instability affecting another fluid flow, such as an artery, another vein, or the cerebral spinal fluid. All of Hauser's laws relate to dynamic structural medicine. Bony alignment, spinal cords, and postures, as well as joint stability, are the pillars of dynamic structural medicine. The effects of normal structural alignment and stability and the effects of misalignments, dysfunctional curves, and joint instability explain the structural cause of human health and disease. So when somebody goes to a lot of physicians and nobody can figure out the cause, one has to use Hauser's laws to try and figure out the cause. Dynamic structural medicine says that human posture, human movement, human joint stability affects gastroenterology, immunology, endocrinology, cardiology, neurology. And when there's something wrong, such as ligament injury, it's going to affect human health, and ultimately you're going to get human disease and symptoms. One of the ways that we tell whether there's a problem in the structure is by a digital motion x-ray. And what we do with the digital motion x-ray, besides just talk about instability, we look at how far forward the head is by the C6AI. That's the horizontal distance between the posterior inferior vertebral body of C6 to a vertical line drawn at the anterior edge of the atlas, and that should be basically 0 to 10 millimeters. And then the depth of the curve is basically a line drawn from the posterior inferior border of C6 up through the dens, and then that line at the C4 vertebrae, how far that vertical line is to the back of C4 at the posterior inferior border of C4. So for instance, this curve, the depth of the curve is 11.3 millimeters. A healthy curve, the depth of the curve is anywhere from 7 to 17 millimeters. And then some people have a reversal of the curve. Like you can see, there's a reversal of the curve there. Hauser's law number 1. If the etiology of chronic pain or joint degeneration remains elusive, it can be traced back to ligamentous joint instability. So you take a ligament, you do a stress strain graph on a ligament. As you put more force on the ligament elongates, and then at some point it starts to fail. And this is the prolotherapy zone. You know, when the ligament starts to fail, the person starts having pain, they start having excessive motion, and it's a progressive disorder. So if you don't do something about it, the ligament can eventually fail, and you get a ligament tear. Now, when you have ligamentous joint instability, the forces on the joint go toward where the ligament injury is. So if somebody has an injury to their medial collateral ligament, the forces are going to go more medial, and that's where you get articular cartilage damage. You'll get a medial meniscal tear. Then it'll propagate further forces on the medial ligament, medial collateral ligament, and that ligament will eventually fail. And then once there's excessive motion here, it'll go to the other side, and the forces on the joint go way up. So ligament damage or ligament incompetency, if it's not treated with prolotherapy or by some other method, then the forces on the joint get changed, which I call force distribution dysfunction. Instead of the forces when you're walking being more in the middle of the joint, they'll go toward where the ligament injury is. So a shoulder problem, if you have a ligament damage in your anterior glenohumeral ligament, it means that when you pitch or you play tennis, the glenoid ball is going to go forward, right? And then the supraspinatus tendon contracts to try to get it back, but basically it can't, and then eventually you're going to get a supraspinatus tear because the force distribution then gets changed where the forces go anterior, so it's more stress on the tendons. Now, one way you can tell that a person has instability is by a dynamic ultrasound exam. So in this particular patient, they had an extruded meniscus. The width of the joint was 4.2 millimeters, meaning the medial space between the tibia and the femur bone was 4.2 millimeters. But when Danielle stressed the joint with a valgus stress, it went up to 7.6 millimeters. So then you know the person has 3.4 millimeters of instability. So if you have peripheral joint pain or some kind of nerve issue related to the peripheral joints, I'd really encourage you to get a dynamic ultrasound exam. And this is a good pictorial of a normal joint. You get a ligament injury, then on the medial side there's a lot of cartilage breakdown, and eventually you get severe osteoarthritis of the joint. And this explains that once you have one loose screw on a hinge and then you open and close the door, the other screws are going to get loose. And the treatment for the loose screw analogy of a loose hinge on a cabinet door is you must get a Phillips screwdriver, an appropriate screwdriver. Much like if you have joint degeneration or you have peripheral joint pain, spine pain, neck pain, and you have ligamentous joint instability, to get at the root cause of the problem, you have got to tighten the ligaments, and the treatment to tighten ligaments is prolotherapy. Prolotherapy injections go down to the bone where the ligaments attach, so they're periosteal or on the bone injections, and it's best to have the joint comprehensively treated. So somebody might just have posterior shoulder pain, but we would do the front of the shoulder and the back of the shoulder, because the most common ligaments that are injured are the capsular ligaments. The capsular ligaments which surround the joint, that's what keeps the joint fluid in the joint. And the joint fluid's job is to help the bones glide really easy over one another. But once there's articular cartilage damage and there's changes in the joint fluid because of ligamentous joint instability, what happens is there's a lot of friction, and that also increases the pressure in the joint. Hauser's law number 2 is when the etiology of a chronic symptom or disease remains elusive, following the neurology will lead to ligamentous joint instability. And for digestive problems, heart problems, because if you follow I'll give you an example. Let's say you follow the neurology of somebody has atrial fibrillation, or they're getting tachycardia, or they're having blood pressure swings. Like a good friend of mine said yesterday, literally his blood pressure was like 75/45 and he felt terrible. And we've already documented that he has a vagus nerve issue. Well, if you follow the neurology of the heart or blood pressure, the neurology will lead you to the vagus nerve. Well, then you have to ask yourself, where does the vagus nerve go? Where it goes right in front of the cervical vertebrae. So the cause of the low blood pressure or the palpitations or the tachycardia or atrial fibrillation may be ligamentous cervical instability. So we made this figure where it says there's different medical conditions such as carpal tunnel syndrome. Then using Hauser's law number 2, that involves the median nerve. Well, the median nerve goes through a tunnel called the carpal tunnel that's surrounded by bones. So if you have ligamentous wrist instability, that could give you carpal tunnel. If you have radiculopathy, it shoots down your arm. Then if you follow the neurology, the nerve root goes into the cervical spine, so you probably have ligamentous cervical instability. Now, it doesn't mean that ligamentous cervical instability is the only cause, right? Because somebody could have a spinal stenosis or a bone spur. But again, what caused the spinal stenosis? What caused the bone spur, right? The bone spur or the overgrowth of bone is likely from a ligament injury years ago, and the body overgrew bone because of all the forces, right? If there's too much force on a bone, the body overgrows bone, and that overgrowth of bone can narrow the space. And that's what's happened in my cervical spine. I was involved in a car accident when I was 14. I'm going to be 62 soon. I know I look much younger than 62, but obviously I'm drinking coffee, so I don't exactly feel like a 24-year-old. There's most days I feel like a 62-year-old. But in other words, my spaces are very narrowed where the nerve root comes out. So I need much less instability to narrow that space further where I get a symptom, right? The more normal your anatomy, the larger or more extensive the instability has to be for you to get a symptom as it relates to irritating a nerve. So occipital neuralgia. Well, the occipital nerve is a branch of C2, so it's likely if you've had radio frequency and a bunch of different steroid shots or different shots for occipital neuralgia and nothing's helped, well, you probably have ligamentous upper cervical instability, and that needs to be treated with prolotherapy. Somebody has top of foot pain or pain from the lateral side of the knee zinging down the foot, and many people have been diagnosed with perineal neuralgia. Well, where is the perineal nerve? Well, it's right by the fibula. And if you have lateral collateral ligament injury or other injuries to the ligamentous complex on the lateral side of the knee, the fibula moves excessively, and then you can get perineal neuralgia. Years ago, I researched quite a bit, and I was shocked at how little extra space there is in the spinal cord, where the nerve roots are, where the vagus nerve is. I'll give you an example. So years ago, I asked a neurosurgeon, like, when you're in surgery, how close is the carotid sheath to the anterior cervical vertebrae? And the doctor immediately said it lays right on it, like it's right on it, like it's millimeters. The nerve roots that go out to your arms and legs, it goes through a hole. Even in a healthy person, there's only a couple millimeters of extra space. Your spinal cord, it's encased in bone, right? The vertebrae, there's only 2 or 3 millimeters of extra space. So that means that if you have a 2 or 3 millimeter instability that's found on digital motion X-ray or dynamic digital radiography, DDR, it's likely it's going to irritate a nerve. And the main nerve that causes internal symptoms is the vagus nerve. So the case I talked about that I met at the coffee house, I have a feeling her vagus nerve is getting irritated, and that's what's giving her internal tremors. So the treatment has to be to restore her cervical curve, and then if she has instability, to get prolotherapy. Oh, this is me injecting a perineal nerve with ultrasound. So again, you have to get at the root cause of the problem. So if a nerve is getting irritated because of ligamentous joint instability, you need to treat the instability, but sometimes you need to free the nerve because, there can be scarring and different things. That's called hydrodissection. So this is just me doing a hydrodissection where you inject 5% dextrose. Sometimes we use PRP to hydrodissect the plane that carries the perineal nerve in it, and you're using ultrasound guidance to do that. So the vagus nerve runs right near the anterior cervical vertebrae, and the ganglion, especially the nodose ganglion, which is the sensory part of the vagus nerve that has to do with the internal organs, that sits right in front of the atlas or C1. And then that's what we see here. See how you have C1, there's the nodose ganglion, the jugular ganglion, it's also in this area. And you can see where the vagus nerve sits right in front of the anterior vertebrae. So Hauser's law number 2, if you have some kind of bizarre symptom like internal tremors, you have digestive tract issues and nobody can seem to know the cause. I mean, you change your diet, you are diagnosed with SIBO, small intestinal bowel overgrowth, you tried mold remediation, you took a bunch of herbs, you fasted, you did a whole bunch of things and you still have the issue, and especially if you're losing weight, or you're so constipated, right? I've had people, they just can't have a bowel movement. Well, the vagus nerve is the electricity to the digestive tract, and then if the electricity is inhibited because there's damage to the vagus nerves because of ligamentous cervical instability, the tight junctions in the digestive tract, they become hyperpermeable, meaning that you eat a meal, but you don't realize that the mucosal surfaces in the digestive tract are leaky because the electricity is inhibited to the digestive tract, and then you develop all kinds of food sensitivities. You get leaky gut. Your sphincter doesn't work, so the bacteria from the large intestine goes into the small intestine, or your ileocecal valve doesn't work, or you get gastroesophageal reflux, right? You follow the neurology leads to the vagus nerves, and the vagus nerves lead to ligamentous cervical instability. So again, instead of having this curve, which is a normal lordotic curve, and the vagus nerve being relaxed, when you have cervical destructure or a breakdown of the cervical curve, the atlas smashes on the various ganglion where the DNA of the sensory fibers of the vagus nerve are, and we measure the diameter of the vagus nerve in the neck, and we find that people with chronic digestive problems, autoimmune diseases, chronic fatigue, inflammation over their whole body, fibromyalgia-like symptoms, heart issues, tachycardia, palpitations, even valvular incompetency, regurgitation, mitral valve regurgitation. All these things can be from vagus nerve degeneration because of ligamentous damage in the neck, irritates, stretches, compresses the sympathetic ganglion in the neck and the vagus nerve. And a lot of this is just from poor posture because of computers and cell phones. And then if you hold a posture for a long period of time, and it can even be during sleep, right? Instead of us sleeping on our side or having our neck extended, the average person puts pillows and they're, even with sleeping, they're all crunched over. So instead of the neck curve being this way, it's reversed. And then basically what happens is it puts stretch and compression onto the jugular vein, onto the vagus nerves, and it causes all kinds of brain and body symptoms. And when the vagus nerve is degenerated, you can get systemic inflammation or autoimmune disease like rheumatoid arthritis, scleroderma, systemic lupus erythematosus, all different kinds of mixed connective tissue diseases, because the vagus nerve goes to celiac ganglion, the celiac ganglion then goes to the spleen by the splenic nerve, so the vagus nerve has some interaction with the splenic nerve. That interaction is what starts the process of anti-inflaming the body. So the vagus nerve is involved in controlling inflammation in the body. It's called the cholinergic anti-inflammatory system. So if you have vagus nerve degeneration, your body's ability to resolve inflammation is hampered, and you're much more prone to having chronic pain, neuroinflammation of the brain, in the body. You could have weird kinds of swelling. You could have a mast cell activation syndrome, right, which is inflammation out of control, which has to do with histamine. Again, this is related to the vagus nerve. And then this is a measurement of the vagus nerve, normal vagus nerve. Here the vagus nerve is getting compressed. The vagus nerve cross-sectional area is 2.7 millimeters squared. Here it's 0.9. So this vagus nerve compared to this is 1/3 the size. So what conditions in the human body do you think would be caused if the vagus nerve was 1/3 the normal size, right? You could get excessive inflammation, immune dysregulation, gastroparesis, nausea, bloating, renal insufficiency, leaky gut, bowel inflammation, diverticulitis, Crohn's disease, ulcerative colitis, irritable bowel syndrome, poor digestion, liver dysfunction, atrial fibrillation, tachycardia, valvular defects, leaky lung, allergies, asthma, even leaky bladder. And then obviously with the brain, you can get all kinds of symptoms, anxiety, depression, brain fog, just from vagus nerve degeneration or dysfunction. And you could yourself in front of a mirror say, ah, and basically your uvula is supposed to be in the middle. See how here the palate is lower on this side. This person has a deviated uvula. And then this person with the tongue blade, they don't have a gag reflex. So if you don't have a gag reflex, the palate is lower on one side or a deviated uvula, that's a sign that you have some vagus nerve degeneration. Depending on what branch of the vagus nerve is affected will determine the symptoms, but it can be hoarseness, inability to sing, or you can't sing as good, your voice is changed, swallowing difficulties, bloating, like I said, dysphagia, dysarthria, hoarseness, eustachian tube dysfunction is a common one, shortness of breath, hyperactive airways, and all kinds of digestive problems. And this just shows how autoimmune diseases and various kind of digestive problems can occur. If you even think about gallstones or liver disease, it depends on the sphincter of Oddi functioning correctly, like the various sphincters that cause bile to be released by the gallbladder. And then the vagus nerve is secretory, meaning that it's going to regulate secretions in the digestive tract because you need bile to be produced. Then you need digestive enzymes to be produced. The vagus nerve is even involved in nutrient level analysis. It's involved in whether you should keep eating, what you eat. And then the vagus nerve is also called the love nerve, meaning that when you sense love, whether it's a conversation or holding somebody you love's hand, that's through the vagus nerve. So what happens is when you have vagus nerve degeneration, you start to get like depressed. You have a much harder time enjoying things. And obviously, if a person keeps going to doctors and they don't recognize that it's a vagus nerve issue and they just want to give anti-anxiety meds or antidepressants, this process is a progressive process. Remember, ligamentous cervical instability injuring the vagus nerve, then if you don't address the ligamentous component to it with prolotherapy and doing curve correction, and obviously there's other components to it like reducing stress and having a pro-vagus lifestyle where you're around positive people, you don't watch too much negative shows or negative news, and you yourself try to be a blessing to others. So the way we look at what's causing the physiology of the symptoms is called neck vitals. Heart rate variability is a great way to tell whether your nervous system is balanced or not, or you have sympathetic dominance. We measure eye pressure, the vagus nerve cross-sectional area, jugular vein cross-sectional area. We look at, is there ocular dysautonomia? And then does a person have high brain pressure? And we document this by non-invasive means, which involve pulsatile index and optic nerve sheath diameter. Now, Hauser's law number 3 is the cause of most chronic disabling symptoms of human disease when the etiology remains elusive is by dynamic carotid sheath compression from ligamentous cervical instability. So even the vagus nerve, which is in the carotid sheath, is affected by ligamentous cervical instability, but in the sheath is also the glossopharyngeal nerve, which has to do with swallowing and blood pressure control. And then the spastic torticollis is from irritation of the spinal accessory nerve, which is in the carotid sheath. I have a few patients where when they come in, they're like this, because this muscle is so tense, it's pulling the head that way, and that's from irritation of the carotid sheath affecting the spinal accessory nerve. And sometimes we even get people where it affects the carotid artery, which is in the sheath also. There's lots of different symptoms that can arise from internal jugular vein compression. Remember, the main drainage ports of the human brain, how the fluid gets out of the brain, are the internal jugular veins. Around 70% of the fluid in the brain is found in the venous system. So the cranial venous sinuses, they ultimately drain into the transverse sinus, sigmoid sinus, into the jugular bulb, and then into the internal jugular veins. So if you have pressure on the internal jugular veins, there's going to be like a rip current heard in the jugular bulb. The jugular bulb is the part of the jugular vein that's in the cranium, and it sits right next to the hearing nerve, which is cranial nerve 8. That's the vestibular cochlear nerve. So when you have jugular vein compression, you can get tinnitus, even pulsatile tinnitus, ringing in the ears. And then if it affects the vestibular component of cranial nerve 8, you can get oscillopsia, you can get Maldi-Barkman syndrome, you can feel like you're on a boat, like stuff spins, C6 feeling. And obviously, if the brain can't drain the 70% of fluid out the jugular veins, brain pressure is going to go up. And when brain pressure goes up, the brain's not going to function so good. The number 3 thing that we see at the Hauser Neck Center is brain fatigue. Then, obviously, if that doesn't get resolved, you get derealization. You cannot feel like yourself, like you're in somebody else's body. You can get depressed, anxiety. I've had people get bipolar. I've had people who had schizoaffective disorder and other mental health diseases, and they didn't realize it was from the high brain pressure because of jugular vein compression. And then the eye nerve, which is cranial nerve 2, and the hearing nerve, cranial nerve 8, they still drain into veins. So if the veins can't drain from the brain through the internal jugular veins, you can get hearing distortion, you can get hearing loss. I've seen more and more people coming in with that. Over 90% of the people that come to the Hauser Neck Center with chronic neck pain, they have visual distortions. They could have blurriness of vision, photophobia or light sensitivity after images, and then basically the image just isn't clear. And then this is just a pictorial. There's no compression of the carotid sheath. The person has excessive motion of the atlas and the axis, then eventually it's going to kink or compress, stretch the vagus nerve and the internal jugular vein. And the way you document upper cervical instability is by motion X-ray. So we just have the person move, and it's very important that you do X-ray images in the position that gives the symptoms. So if for instance, I've even had people where, Doc, I'm just telling you, every time I move my left arm, I get dizzy. So we'll do images when they're moving their left arm, and we'll look at blood flow, and inevitably, like I had a patient recently where they did this, and basically the block was in the innominate vein or brachiocephalic vein. So if the vein down here is blocked because of a rib problem or a first rib instability or instability of the clavicle, that will cause increased pressure in the internal jugular vein and all the symptoms that we talked about before. Potential chronic disabling symptoms due to vagus nerve dysfunction, degeneration from cervical ligament injury. So it's amazing all the different symptoms that can occur because of vagus nerve degeneration. Even cranial nerve dysfunction, like we talked about, visual nerve, cranial nerve 2, the hearing nerve, cranial nerve 8, and we've even had people with burning mouth or trigeminal neuralgia, different kinds of tensor tympani myoclonus, like I said, spastic torticollis. So this explains a lot of the various symptoms that people have that no one seems to be resolving. And then we check the internal jugular vein cross-sectional area in different positions, lying down, turn the head, look up, and then also when the person's upright. So when you're laying down, the jugular vein is supposed to be open, and then as you stand up, it gets more and more closed. So it's very, very important to sleep in a position where your jugular vein is open, because during the night, that's when the brain gets rid of all the waste products, brain pressure goes down, and the brain regenerates, right? Your brain needs to be regenerated, and the body needs to be regenerated. The nerve that regenerates the body, that's the vagus nerve, and how the brain regenerates is by, during various phases of sleep, that the brain flushes, and that can only occur if the jugular veins are open. And this just shows how close the jugular vein is to the cochlea, which is how we hear, and these are the semicircular canals that have to do with balance. So if you're like going like this, woo, 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 and it's driving you crazy because you don't have gaze stability, then you got to think, well, maybe the internal jugular vein is getting compressed by ligamentous cervical instability. So Hauser's law number 3 is that when you have a chronic symptom and it's very disabling and nobody can come up with the cause, it's probably going to be ligamentous cervical instability causing dynamic carotid sheath compression where the internal jugular vein or the vagus nerve is affected. And then basically, if the brain can't get rid of the waste products, they accumulate, right? So it's going to accumulate, and then basically, eventually, the pressure and the toxic soup that's there, brain neurons die from high brain pressure, and I think that's what causes a lot of cases of brain atrophy and dementia. So if you are starting to notice that your memory is starting to decline, or somebody that you love, please look at the neck, because you may have ligamentous cervical instability, cervical destructure, breakdown of the neck curve, blocking the cerebral spinal fluid or internal jugular veins, high brain pressure, the blood-brain barrier breaks down, all kinds of toxic substances from the blood reach the brain, toxic metabolites get into the brain, and it's just a setup for very, very bad brain function. This just kind of shows that the polluted brain, the metabolic waste products accumulate, the lymphatic system of the brain can't get rid of them, and then eventually you get a clogged brain toilet or toxic soup where you get neuroinflammation in the brain, which really can only get resolved if the toilet is unclogged, right? So the way you get the plunger here is you got to get rid of the jugular veins getting compressed here, right? So this person has a forward atlas. They got ligament damage here. It's compressing here. So you got to restore the cervical curve. And then if there's instability, get prolotherapy. And the whole process can take anywhere from 3 months to a year usually. And then eventually the jugular veins are open, and then the person's like, oh my gosh, I feel so much better, so much energy. I think a lot of chronic fatigue now is brain fatigue. You know, especially if somebody eats a reasonable diet, they have good relationships, they like their job, they love God, you know. So I want to talk just a little bit. If you have eye symptoms, you have blurry vision, photophobia, light sensitivity, you have gaze instability. So it means that, like when I look at that, it's steady, the image is steady, that's gaze stability. If it's moving, that's called gaze instability. So there's conditions such as oscillopsia, Malda-Barkman syndrome, obviously different kinds of vertigo, Meniere's disease. It can all be from obstruction of the jugular vein. And then when there's sympathetic dominance, because there's vagus nerve degeneration, the pupils dilate, right? So the superior cervical sympathetic ganglion sits right in front of C2. When the vagus nerve can't inhibit it, the body senses stress, and that's where you get a dilated pupil. Well, the problem is if your pupil is always dilated, and you know it's dilated because you got light sensitivity, well, that changes the architecture of the eye, and then it blocks normal fluid flow within the eye. So just like the brain, the eye then can't drain normally. And when the eye can't drain normally, eye pressure goes up, and metabolic toxic products from eye metabolism can't get out. And you can get any sort of eye symptom, macular degeneration, retinopathy, cataracts, blurry vision, you know, all different kinds of eye symptoms. And then we can tell whether or not there's fluid around the eye nerve. Like here's a normal one, 5.1. This is an ocular ultrasound, and see, this is twice as big. So this person has 5 millimeters of fluid around the eye nerve. So imagine if one eye nerve has way more fluid around it than another. It means the images that you see out of both eyes, by the time it gets to the brain, it's getting there at different times. So that, of course, would give after images, double vision, blurry vision. And then this is transcranial Doppler examination. This is another way that we check for high brain pressure. When there's high brain pressure, the middle cerebral arteries can dilate and the pulsatile index goes up. And the pulsatile index is a measure of what pressure against which the arteries in the brain are contracting. It's very common for people with insomnia, anxiety, personality changes to have crazy high middle cerebral artery velocities. Normal velocity is about 65, and we'll have people that have 150, 120. Like, imagine you're going on the highway and you're driving 65 miles an hour, but somebody zooms by you going 130 miles an hour. Well, imagine if that was going on in your brain. You know, like, you're just not going to feel good. Like, you're going to feel dizzy. You're going to feel anxious. Hauser law number 4. Let me see if it's here anywhere. Oh, here's Hauser law number 4. If the etiology of a chronic disabling symptom or disease is not found using Hauser's law number 1 to 3, the cause will be an alternative fluid flow obstruction. Meaning that, let's say in the office we test somebody and the jugular veins are open, right? The jugular veins are open and they have, say, dystonic storms. So basically there has to be some other fluid flow that's obstructed. So here I'm looking at the vertebral artery, and this particular person, when the blood flow stopped in the brain, like it stopped for, let's say, 8 or 10 seconds, and all of a sudden the person basically had a seizure-like activity called a dystonic storm. That's not from an internal jugular vein compression, it's from a compression of the arteries that go into the brain, which could be the vertebral arteries or carotid arteries. This is a venogram. That's another good test to show the veins. You could see right here the internal jugular vein is getting compressed at the atlas. The carotid sheath with the carotid artery or vertebral artery could get obstructed, and then the cerebral spinal fluid, right? The cerebral spinal fluid surrounds the brain. the cervical nerves, the cranial nerves, the brain stem. So a person could have ligamentous cervical instability and could block the cerebral spinal fluid. Again, that would increase the brain pressure and could give a lot of symptoms. And depending on what part of the brain the pressure goes on. So since the frontal lobe is what inhibits behavior, the frontal lobe has a lot of inhibitory things. So if somebody has obstruction of the CSF or the jugular vein because of upper cervical instability, and the CSF pressure goes up on the frontal lobes, well, all of a sudden the person could get manic because they don't have any inhibition. Also, many of memory and problem solving and higher cognitive functioning, many of the nerves that are involved in that are in the frontal lobe. So basically, like my patients will often say, "Doc, I feel like I'm getting dumber and dumber and dumber. Like everything takes me longer." Some people can't even work anymore because they just don't feel good. And it's so exhausting even to solve common things. We had a gal from Montana, like a 16-year-old who was an honor student. And because of this process, she went down to reading at an eight-year-old level. So she was an honor student, then she went down to reading at an 8-year-old level. So, and it can happen very, very quickly. And I'm happy to report that person's fine now and she's going to be going to college. But upper cervical instability blocks the CSF or the jugular vein, increased pressure, can affect different parts of the brain. When it affects the temporal lobes, this is the temporal lobes, that's where you get episodes where somebody might be like looking and then all of a sudden they might be going like this, like, it's a type of seizure. Now, it may not meet the real strict criterion where you can't find seizure activity on the EEG, but it's basically involuntary where neurons are firing, and it can be just from temporal lobe pressure. So here we'll watch one of our patients. See how she's twitching? See how she's twitching? See, and then we're looking at her blood flow, and she's starting to twitch here. Like we had her turn her head. So we measure blood flow, and then you'll see that, and she just starts going like this, going like that, right? It's totally involuntary. So she has ligamentous upper cervical instability that's being treated with prolotherapy, and she should make a complete recovery. And remember the vertebral artery, right? The vertebral artery is in the cervical vertebrae. So any type of extra motion of the cervical vertebrae can kink the vertebral artery. That can give vertigo, dizziness, fainting. Somebody who has fainting spells, or all of a sudden they go from 0 to 100 as far as anxiety. The brain is not getting all the blood supply it needs. One has to look at, according to Hauser's law number 4, it's likely that there's some kind of alternative fluid flow obstruction, being like the vertebral artery. I'm seeing signs and symptoms or precursors to dementia in 20-year-olds. Now this is basically a 50-year-old where you start seeing hydrocephalus, like in other words, there's so much fluid in this person's brain, it's squelching out the actual brain tissue. These are called white matter lesions. So these are areas where the brain is already getting destroyed. So if this person doesn't resolve their internal jugular vein compression or cerebral spinal fluid compression by doing cervical curve correction and prolotherapy to stabilize the neck, then this is a progressive disorder, and again, it's a precursor to dementia. So you're already seeing brain damage, and they're only in their 50s. These are just venograms. You could see where sometimes people have a styloid, which compresses the jugular vein, so sometimes that has to go, that has to get out. You could see that this is at the atlas, the jugular vein is compressed. According to Occam's razor, the simplest solution is normally the right one. So by the time this person came to Caring Medical, they probably had 10 to 15 different diagnoses. So According to Occam's razor, does a person have 10 or 15 individual diseases or maybe one disease, which is ligamentous cervical instability, especially the upper part, blocking the jugular veins, which is causing brain symptoms, and injuring the vagus nerve, which is causing body symptoms. And if we do cervical curve correction and strengthen the cervical ligaments, many of these symptoms, and hopefully all of them, will be resolved. Ligamentous cervical instability can cause anything from drop attacks, obviously vagus nerve dysfunction, visual disturbances, degenerative disc disease, autonomic nervous system dysfunction, dysautonomia, increased intracranial pressure, ischemia or insufficiency of the vertebral artery, even facial pain, trigeminal neuralgia kind of things, vertigo, tinnitus. Ligamentous cervical instability causes dynamic compression of the carotid sheath, breakdown of the blood-brain barrier, increased brain pressure, brain symptoms. Dysautonomia causes all kinds of internal organ problems. And then obviously if this CSF or artery is blocked, you can get acute symptoms like a seizure, movement disorder, drop attacks, fainting. So the approach to resolve it is restore cervical instability by prolotherapy. When there's negative changes or cervical destructure, then looking up lifestyle, having somebody's computer really, really high, any sort of activity that will strengthen the neck muscles is going to be helpful. So wearing prism glasses. And then if there's misalignments, gentle vertebral adjustments, gentle, so no really forceful rotational ones. So upper cervical chiropractors use instruments to do gentle adjustments to realign the atlas, and that can put the atlas in alignment. And what I like about it is that the person can know almost immediately whether the atlas is involved with a symptom. Like for instance, if somebody had migraine headaches, and they get an atlas adjustment, it goes away, at least you know it's related to the atlas. And then this is Julie Hunt, the Hunt Mayer Clinic in Clearwater. She's a brilliant doctor. When her father just recently retired, he's in his 90s, and he is one of the grandfathers of orthospinalogy. And then these are some of the things somebody can do. A patient of ours put the computer up high. This is me with different devices, proper posture, like, to get my neck stronger. Obviously, trying to sleep in a position that opens up the jugular veins. This is a Denerol pillow. Physical therapy, that's a Denerol to restore the cervical curve. And sometimes we use halo weights or different weight systems. That's Izzy, who's behind the camera. And then this just basically shows that we can x-ray somebody on a Denerol, and we can measure the jugular veins to see if they're more open if we change the curve. So x-ray of cervical curve with various postures and therapies. Neutral, upright, improvement of the curve with posture cues. So this person, basically, we just had them do posture cues, and you could see, so somebody's computer, sometimes you just need posture cues. And then this is supine. This is laying on a Denerol. And this was a cutout pillow. And you can see it's much better cervical curve. When ligaments get degenerated, they basically are weak. So prolotherapy causes fibroblasts to proliferate. It used to be called fibroblastic proliferation. Dr. Hackett coined the term in the 1950s. Proliferative therapy. So you proliferate the cells that make ligament tissue or collagen tissue, and those are fibroblasts. So fibroblastic proliferation. So tendinosis, ligaments, you have a deficiency of cells. Prolotherapy causes cells to rush in the area, and then ultimately you get strong, tight, rope-like ligaments, and you can document the improvement by motion x-rays. And this is just a pictorial showing prolotherapy to the capsular ligaments. Typically with prolotherapy, it's 3 to 6 visits with peripheral joints if the instability is not so bad. Obviously, with some of the necks that I see, there are times where it's 10 to 15 visits, depending on how severe the instability is. And people often ask, well, I feel better after the first visit. I always say it's normally 2 out of 3, and after the second visit, 3 out of 4. But to actually resolve the symptom, it does take a while, and there has to be a lot of stabilization and improvement of the curve to resolve the ligamentous joint instability or cervical instability that's causing the person's symptoms.